So this is a case, a 75-year-old male, and it says she has some kind of problem in her pancreas. So I was scrolling up and down, and I've noticed there is atrophy of the tail of the pancreas and a irregular dilatation of the duct. And the dilatation of the ducts comes from the tip of the tail and goes all the way. It's supposed to go all the way to the head of the pancreas, but it stops right there. So if it stops here, there must be a reason for that. So in this portal enhancement phase, venous hepatic phase, I can't really tell because the entire pancreas shows quite the same enhancement. Also on the pre-contrast phase, I can tell there isn't much attenuation difference between any parts of the pancreas, but I can tell there is dilatation of the duct and of course atrophy of the tail right there. So what should we do? We should grab a arterial phase. Why is that? Because the pancreas, the normal pancreatic tissue, the normal parenchyma of the pancreas is very quick to enhance, so it's bright on a pre-contrast in a arterial phase, especially if it's an early arterial phase, which is not this one. This is a regular arterial phase, a hepatic arterial phase. But I can see the head and the uncinate process are bright, and there is a section of the body of the pancreas that is enhancing, but it's a bit less than the rest of the body, the head and the tail. So what is left of the tail is quite bright too, but this part right here, right beside the site where the duct stops, is bright, but not as bright as the rest of the pancreas. So this right here, I'm going to window and increase the zoom so you guys can see. This is a tumor. This is a primary tumor of the pancreas, most probably a adenocarcinoma, which is 95% of pancreatic tumors and almost 100% of such tumors in this age group, 75-year-old female. So let's just do a quick and dirty measurement. 27 millimeters, which is 2.7 centimeters. So this is a tumor, a primary tumor of the pancreas. This is lethal in most of cases. There isn't any signs of secondary disease still, but we know most of the times there is already micro-metastases in such cases and presentations. So this is a major disease. See how the tumor on the portal venous phase, it just disappears, and in the arterial phase I just need to do a very brief windowing maneuver to get a hold of the tumor in plain sight, just like that. If I didn't have a arterial phase or a pancreatic arterial phase, which I don't, it would be quite difficult to measure, but I would be able to say that there was something wrong with this case. So all in all, this is it. This is what I wanted to show you guys. This is a very difficult case for the patient and an easy case for us to make a major diagnosis. So I'm just going to check here my report so I can send it over. And we are going to grab another exam from the queue, because there is lots of exams in the queue.